Whether you're working from home, working in the office, working out, vacuuming, standing in your kitchen, sitting on a park bench, out for a walk with your wife, out for a walk with your husband, or standing in front of a green screen, heart attacks are bad for your health. And not just because a heart attack in front of a green screen allows a medical event like this to occur in the most unfortunate or embarrassing of situations. The CDC says that more than 800,000 people have heart attacks every year in the USA, of which 3/4 of those are someone's first heart attack. And heart attacks are often the result of heart disease, the leading cause of death for most people in our fair country. It's no wonder that experts say that early and on-time diagnosing of heart disease is essential to saving patients' lives.
We know that patients who are at risk of sudden cardiac death usually have access to excellent cardiac imaging, and for that we use the Rolls-Royce of imaging, which is cardiac MRI. That tells us everything we need to know about the heart muscle structure and function.
That's a doctor out of the University College London Institute of Cardiovascular Science and Royal Free Hospital in the United Kingdom of Great Britain and Northern Ireland, explaining that while modern medicine has some great tools for taking a look at a heart's condition, they haven't always assembled a full picture.
But the missing bit of the jigsaw has always been the electrics of the heart. So up until now, there was no convenient and easy way of integrating the electrics of the heart on top of all this amazing data that's coming out of the cardiac MRI scanner.
Now our doctor here just said up until now, because she, along with other doctors and researchers at her university, have just developed a new piece of technology that can assemble more detailed information about the heart and even help predict heart attacks. And they're calling this high-tech device a vest. Now, it's not exactly a John Tesh style fashion piece, even though it does kind of have a paisley pattern, but then again, it's only meant to be worn for a few minutes at a time.
What it basically consists of is a vest which a patient can wear for 5 minutes at rest or rest during exercise, and it's embedded with 256 sensors, shall we say, which don't have any gel, so they're quite comfortable and easy to wear, and it gives us a huge amount of electrical information, mapping the heart not as a single signal, but mapping the heart panoramically.
Now before, in order to get a clear map of the heart's electrical activity, it required the use of a catheter to be inserted into the cavity of the heart, a pretty invasive process, or the use of a different, expensive, single-use device that was hard to set up and required radiation. But this new wearable tech, called an electrocardiographic imaging vest, is reusable and washable.
So we literally get three-dimensional maps of the heart, and we can look at the electrics of the heart propagating all across the cardiac chambers. And then when the patient goes in to have their MRI scan, at the end of the scan, we are able to map that data onto the MRI scan.
Yeah, so if an MRI scan produces a map of your heart as if your heart were a country, which sounds like a very loving place, kind of like Canada. Let's use this map of Canada. What this vest now provides is kind of the equivalent of a map with the roads and rail networks running throughout the country when combined with the MRI scan. And voila, you get this 3D image of the heart, where these red pulses show off the heart's electrical activity. It kind of looks like a screensaver, but it's really more of a lifesaver.
Most of the catastrophic cardiac events that happen to patients and also in the general public are usually driven by sudden, dangerous heart rhythms, in other words, cardiac arrests, which sometimes happen in people who have diseased hearts, but sometimes it also catches us unprepared. It happens in people who have seemingly normal hearts. And this technology will allow us for the first time to collect very detailed electrical information of the heart and map them onto the structure and function in a way that is safe. It can be rolled out at scale on thousands of people at a fairly low cost compared to other competing technologies.
It's no more, I suppose, than sitting with the big jumpers on or something like that in that sense. There's no discomfort with it at all.
Jumper is British for sweater, and our man here has not only taken part in a trial of this vest, he's also a member of the British 1946 birth cohort, a large-scale study of the health and social conditions of more than 5,000 people born during a week in March of 1946. Needless to say, he's quite used to being observed, and he didn't feel much discomfort wearing this high-tech heart jumper.
There's no feeling at all, really, I suppose. I mean, you obviously feel you're lying on something, so you've got that little pricks, I suppose, on the back you can feel. And then when it's pumped up, you can feel the pressure of that. But it's not uncomfortable at all.
That's in contrast to this procedure he's undertaking here, the ECG, which isn't invasive but can be uncomfortable and produce excessive waste. Here's another doctor who helped develop the ECGI vest.
Setting up a normal 12-lead ECG involves 4 leads on the limbs and 6 leads along the chest. One of the issues with it is that we have the gel electrodes, so they can be quite uncomfortable for patients, and they can also be skin irritants. And also these gel electrodes, they can only be used once, so they get thrown away afterwards. Whereas on the ECGI vest that we've developed, we use dry electrodes, so we don't need to use the gel, so it's a lot more comfortable for patients. There's no skin irritation or discomfort, and also the potential for the vest to be sort of worn during an exercise test, for example, as well, which would be a bit more difficult with the conventional ECGs.
To date, our vest here has been trialed on more than 800 people with positive results, and it's ready to be rolled out to more patients. While it's currently being used to map people with a few specific heart muscle diseases, it's also believed this new ECGI vest will help identify patients who need an ICD, or implantable cardioverter defibrillator, a device that monitors the heart's rhythm and shocks the heart back to a normal rhythm if necessary. ICDs can save lives, but they carry a risk of infection and can cause distress if they give out unnecessary shocks. While these trials took place in the UK, a company patented the vest in the United States and is looking to figure out how to manufacture the device on a wider scale, which will hopefully lead to a better understanding of the heart health of people sitting on their couch, chopping vegetables, or hanging out on Mars. I mean, standing in front of a green screen.